It's very nice. Thank you. So give it a few more minutes and then we will get started. Juliane, how was the weather there today? Well, it's already almost evening there.
Yeah, it's very warm. We had snow last week and now it's so warm. It's really nice and sunny. So yeah, it's really great.
Spring is coming. Very nice.
Yeah, absolutely. And for you?
Thank you. I am in San Diego and we have a very gray weather over the past few days. So it's well, it happens, but we like the sun more, and it's warm, but it's just very gray. So we are getting used to the new time, as you know, based on our weekend fiasco. We changed the time, so it's very early. It feels very early here even now.
Yeah, yeah. I think we will have it next week. Yeah.
Yeah, I think it's a couple of weeks when there is this change.
Yeah, but it's very nice when it's in the morning, if it's already the sun's there, so it's good.
It is. It's nice to have long afternoons, but the first week is very hard for me. No atmospheric rivers at our house, Raz, but there are many, lots of rain this year, yes. Yeah. Craziness. Thank you so much, everyone, for joining. We are just gathering, and I will get started here in 1 minute to introduce our esteemed guest. Kara, do we have any additional background slides for today before we start the presentation?
I have just the agenda and then a couple updates for the next meeting.
Would you mind to start us off on that? Would you like to present those 2 slides and then I can take over and introduce Dr. Mielke?
Yeah, so good morning, everyone. Today, we're going to just provide some brief updates, and then we will move into introductions, and then our presentation, and then have a wonderful discussion with our presenter. So for the next monthly meeting in April, we have Dr. Kelly Ashbrenner, who's going to be presenting on her leading a user-centered design methods pilot with quality improvement staff at community health centers that involve health equity centered adaptations. And then we're also still looking for additional presenter nominations. So if you know anyone that you would like to hear from, or if you yourself would like to present at one of our monthly meetings, please either scan the QR code or I apologize, I have a dog that likes to play with the toy right behind me. Or follow this link that I'm putting in the chat. And you can submit your nominations there.
Thank you so much, Kara. There are some additional resources that we have available to you all. I'm sure you remember. We have shared these. One is an annotated list. And Kara, we can go back to this slide if you would like.
I'm having a little difficulty with PowerPoint right now. Give me 1 second.
No problem.
There we go.
So anyways, the point is that we have some resources available. And if you have other resources that could be helpful for this group, we would appreciate you sharing those in the chat. And as Ross suggested it, please use the chat. We will be monitoring it and inviting you to share your thoughts. So I am just really excited because this was certainly on a short notice that Dr. Juliane Mielke is able to join us today. She is a postdoctoral research fellow at the Institute of Nursing Science at the University of Basel in Switzerland. She has a background in nursing and worked for several years in acute care settings in Germany and Switzerland. Juliane completed her PhD in 2022, and congratulations on that, that's wonderful, which included the development of a methodology for studying context and implementation science. Her current research interest focuses on the combination of implementation science, system science methods, and routine data in integrated care research. And I would say that we were so excited to find a specific publication that we assigned for you all to read prior to this presentation today. But I have already found another one that you published, Juliane, that described that multi-level model. So I have been reading that as well with great interest. I also want to pass on apologies, and it's basically my fault that Dr. Sabina de Gist is unable to join us today. She has another presentation, and this is just a note to all of you that there are 2 weeks in spring and 2 weeks in fall when Europe and the US are only 8 hours apart. And this is one of those, and I was unaware of that. So the initial invitation, we thought she would be able to join us, but she's not. And so we will thank her for supporting Juliane to be here, and they will be reviewing the recording together to discuss some potential additional contributions, and hopefully we get to invite her for another time. So Juliane, thank you so much for being here today. We really appreciate it. As you can see, we have a nice group of people with us. We are generally changing who is able to be here, but this group has been around since 2006, co-led by Dr. Raz Glasgow, who is here, and then more recently, Kara Swanson joined us. She's managing the group for us. And I just want to welcome everyone who is here and hand this over to you. The process will be that Juliane is going to talk a little bit about this paper that we shared with you ahead of this presentation. And then we will have a discussion with her about this publication. So again, thank you for being here, and I will hand it over to you. And if you have slides, I think you will be able to share them. Wonderful.
So thank you very much, Rosika and Russ, for your warm welcome and your invitation to present our work in this meeting. As you said, the presentation today focuses on an evidence gap map we conducted on implementation intervention studies. And the aim was to identify which methodological approaches were applied to study context. So when we refer to context, we also always use this metaphor of the muddy place, because there's a huge variability in definitions and terms used for context, and few guidance on how to study it. And this is problematic because it limits a comprehensive understanding of context, and also it limits also the contribution of contextual analysis to support the quality and the success of implementation science projects. So in the Basel School of Implementation Science at our institute, we position contextual analysis as a separate phase. So contextual analysis is really foundational to inform all subsequent phases in an implementation science project, and allows in the end to move faster to real-world translation and to achieve improved outcomes in real-world setting. So usually our projects have a phase A, that is the contextual analysis, based on which intervention and implementation strategies are developed or adapted. And I mean, this usually requires a lot of resources. So we spend a lot of time in the beginning, which is sometimes difficult, but it allows us to move in the end faster to real-world translation. And of course, it also requires financial resources. So in the European Union, we are lucky that we receive funding for this important phase. I know that it's sometimes not the case in the US. So this is really something where, yeah, we are really lucky. Then phase B includes the evaluation of effectiveness and implementation outcomes by applying hybrid designs or other designs. And of course, in the arrow on the left-hand side, stakeholder involvement and the use of theories, models, or frameworks is essential throughout all phases of an implementation science project. So why is it so important to study context? Because the effectiveness of an intervention is dependent on that. So it's dependent, first of all, on the intervention itself, but also on its implementation, so whether it arrives in practice, and also the context in which it is implemented. So, for example, available resources, organizational culture, or leadership. And in addition, there are also implementation agents or stakeholders within a context that are in some way affected by the intervention and implementation. And understanding this interconnectedness of context and the other aspects is critical for our understanding of effectiveness mechanisms, so why something works or not, but also for the implementation success, sustainability, and scale up. So what is contextual analysis? There is no operational definition, but we see it as understanding the bigger picture and bringing all the different puzzle pieces together. So we define it as mapping the dynamic, multidimensional, and multi-level contextual factors that are relevant for the implementation of an intervention in a specific setting. So other terms you might have come across are, for example, pre-implementation phase, contextual inquiry, or designing for dissemination, implementation, and sustainment. How can you assess context? As I said, there's few guidance, and we developed based on a publication by Stange and Glasgow et al., which was done in the patient-centered medical home research. We developed the Basel approach for contextual analysis, the banana approach. And the banana entails 6 components to guide a contextual analysis. And the first one is, of course, choosing a theory, model, or framework that guides your contextual analysis. Component 2 is using empirical evidence to identify relevant contextual factors. So meaning you conduct, for example, a literature review to study what information about context is already there and what needs to be assessed. You can also use local data or ask experts in the field or clinicians. Or, yeah. Then the third component is, as in all other implementation science project phases, stakeholder involvement. And based on these 3 aspects, you then develop your study design for contextual analysis. So as I said, contextual analysis is really a separate study phase, and therefore you also have your separate study design, which includes the methods and time points for data collection. And here, this is really dependent on your individual implementation project. There's no checklist for how to do this. You really need to think this through and decide which, for example, data needs to be collected, what is already out there, is a primary data collection needed, or sometimes you can also use real-world data. And when you designed your contextual analysis and collected your contextual information, you need to think about the relevance of this information in view of the intervention development or adaptation, the selection of implementation strategies, and the interpretation of outcomes. And finally, the reporting of the contextual analysis and its findings is very important, and this is the focus of the presentation of today. So, as I said, although context is very important, it remains understudied and underreported. And the challenges we currently have are that there is no operational definition of contextual analysis. There is few guidance for how to conduct a contextual analysis. So often individual factors are assessed without considering interactions in context, or contextual analysis is not linked to further study phases or conducted retrospectively. And finally, the methods to study context are only partially explored. So this was the aim of our evidence gap map, to understand which methods have been used. And as I said, we conducted an evidence gap map, which is a systematic collection of evidence, and it has usually a broad scope with the aim to describe the size, the characteristics, but also gaps of current evidence. So we started to identify intervention implementation studies, and we wanted to assess or determine the proportion of those studies that report on contextual analysis. So this was the first aim. And then we assessed only those studies that reported a contextual analysis and mapped and evaluated the reported approaches. Which studies were included? So for the first step, we included all peer-reviewed articles or study protocols that were implementation intervention studies. And we excluded studies that only reported a process evaluation. For the papers reporting on contextual analysis, they need to report on contextual analysis, this is clear, but we also included those that assessed context only as part of a process evaluation. And we recognize that some studies published their findings not only in one paper, but in several papers, so we also included those papers with additional information on the contextual analysis. As the literature search and implementation science is usually difficult, we used an empirical search string, which means that we first did a rough search of the literature where we identified articles that fit very well our inclusion criteria. And based on those articles, we developed a development and a validation set. And we then used PubMed Reminer, which is a software that extracts all the terms used in the title and the abstract and provides also the frequency. And based on this overview, we developed the final search string and tested it against the validation set. So in the end, we achieved a sensitivity of 95% of the literature search string. And this is really good compared to other reviews in the field. So for the process, we started with a literature search on PubMed and searched this intervention implementation studies that were published between 2015 and 2020. And as I said, for the purpose of the evidence map, we wanted to review only a sample of papers and not all existing literature. And therefore, we randomly selected 20% of the articles from each year. And to assess those articles, we used a stepwise approach. In our first step, we assessed all identified intervention implementation studies. And in step 2, we assessed only those that reported on a contextual analysis. So in total, we included 110 studies. And of those, 24 conducted a contextual analysis. For the data extraction and analysis, we used the Context and Implementation of Complex Interventions framework, the CC framework. And for us, this is the most mature framework in regard to context. It's a meta framework that integrates, among others, the CIFA framework, and it can be applied as a determinant and evaluation framework. And what is new is that it differentiates between the context and the setting. So the context is much broader. It includes the 7 domains you can see here, for example, geographical or epidemiological. And the setting is really the physical location in which an intervention is implemented. And the CC framework includes an ecological perspective and points ample attention to the macro level. And what is also new in this framework, that it considers not only the intervention that is implemented, but also other interventions that might affect the implementation process at the same time. And we use the banana approach to evaluate the described methodological approaches. So overall, we included those 24 studies that reported on context, and most of the articles were study protocols. The most frequently, they were most frequently conducted in North America and Europe, and in the healthcare setting. The designs that were reported were most commonly the hybrid type 1. In regard to the time points that were used for the contextual analysis, we saw that there were several studies that assessed context at 2 or 3 time points. Most commonly, context was assessed in the preparatory phase or in the middle of the project. We then created an interactive online evidence gap map, and it provides an overview of all contextual and setting factors that were assessed in the studies, but it also shows areas of context that were less recorded. So the colors indicate the method used, and the size of the dot indicates how many studies assessed this factor. So the larger the dot, the more studies assess these factors. And you can see that most of the studies focused on the meso level, which refers to the organization, and includes, for example, factors like leadership, networks, organizational culture, or communication. And a lot of studies assessed social-cultural aspects of context, for example, knowledge and perceptions, lifestyle, or social structures. We also looked at the setting, the 3 boxes on the right side, and most commonly work environment was studied. So this includes, for example, the availability and accessibility of resources, and practice patterns on the meso level. So this includes service delivery or care planning. We then use the banana to evaluate the reported approaches. So you can see on the left the different components of banana. And we applied a color coding scheme. So green means that a component was clearly addressed. Yellow, it was only partly mentioned, and red, that it was not addressed. And first of all, you can see that there is a lot of yellow and red, indicating gaps in the reporting of contextual analysis. And when we then look more specifically, there were only few studies that used a theory model or framework, and only 1 study reported the use of a framework specifically for contextual analysis, which was the CIFA. And the others used it more generally for the overall implementation process. In regard to empirical evidence, only some studies used it, for example, research evidence or local data and information or professional knowledge. And methods that have been applied were also varied a lot between the different studies. About half used quantitative and qualitative methods. About 10 of those used mixed methods approaches. In general, most commonly qualitative methods were applied, and we listed here different methods. So quantitative methods usually are surveys, and qualitative methods, individual interviews or focus group discussion. But some also used observations or site visits. The photo voice methodology, this is a participatory research methodology that where participants record and reflect on their experiences by taking photos and then discussing this in sessions. Learning is a structured qualitative methodology. It's usually used with indigenous people. It's kind of storytelling. A side note here, we did not identify any methods related to system science or rapid ethnography, although we think that this might be methods that, especially the system science, help us to understand complex interactions and changes in context. And the ethnographic methods are very helpful to detect ritualized everyday actions or understand cultural and social norms. So these were methods we couldn't identify in our evidence gap map. Regarding stakeholder involvement, there were about half of the studies that involved all stakeholders. We have this more in detail. So all stakeholders mean that these studies involved members of the target group, so stakeholders that are directly affected by an intervention, those that actively implement the intervention, implementers, and decision makers are those that decide on the implementation of an intervention. Other stakeholders we could identify in the review were, for example, healthcare providers or leaders and administrators or others that provided input on the implementation project. But what you can see is here that most of the stakeholders that were involved were implementers, and most commonly qualitative methods were used for stakeholder involvement. And finally, the use of contextual analysis, contextual information for intervention development, adaptation, selection of implementation strategies, and interpretation of outcomes. Here you can also see that only some studies use those information to inform further study phases. So in the end, we provide a novel framework for mapping and evaluating methodological approaches to contextual analysis. And the evidence gap map points towards aspects of contextual analysis that need further development. And as the literature evolves, we can also adapt this evidence gap map and have then an overview about the development of the literature. A strength was the empirical search string, which provides a high sensitivity. But of course, we also have limitations. For example, the random sampling approach, we included a lot of study protocols, more than original studies. And we did not differentiate between the different implementation science project phases. So we did not assess if there are differences between the methods or the contextual factors assessed in the different phases of an implementation project. And again, at the end, I would like to highlight the importance of contextual analysis and implementation science projects as a foundational phase that supports a successful and a sustainable implementation of interventions in the real world. And as I said, what we found in this evidence gap map, there is really a wide variation in approaches applied for how to conduct contextual analysis, and also how this information is then used for the further study phases. And to overcome this muddiness, we suggest to develop, test, and further improve the methods for contextual analysis and reporting. For example, by using also system science methods or rapid ethnography. For the reporting, for example, banana could also be used. And to really embrace contextual analysis as an essential element in every implementation science project. And not only in implementation science, but also in clinical research, that you really start at the beginning to think about your context and what it means for example, your intervention or implementation strategies. And as contextual analysis is really resource intensive, there is a need to develop specific funding opportunities that support this essential phase. So in this regard, at the end, I would like to bring the Swiss Implementation Science Network to your attention, which focuses on providing training opportunities, for example, in regard to contextual analysis, but also other important topics. It also has the aim to leverage funding options and provide network opportunities, and we have regular webinars that will be announced via social media and on our website. And in June, we have the European Implementation event together with the European Implementation Collaborative. And yeah, we would really like to welcome you in Basel. So here are our contact details, and I'm really looking forward to your questions and discussion. And maybe I stop sharing.
Well, thank you so much, Juliane. This is Russ. That was a fantastic presentation, and congratulations to you and your colleagues on a great series, not only this paper, but a great series of work. I have to say, I loved both your slides and your figures here, and also the use of the displays of the evidence gap analysis. I thought we're just using the banana. I just thought really helped to visualize everything really nicely. I have to start us out a couple questions, since I don't see a lot in the chat yet, so I hope people will chime in here. But I was intrigued at a couple of things from your results. I just wanted to talk a little bit more if you recall. And the first one was, it was interesting to me that people had assessed context at a fair number of different time points during the study there. And frankly, I was a little surprised, because when I see the literature, people do it just kind of pre or during the planning stage. But I'm wondering if you recall, and I apologize if I missed it, but how many of the studies assessed context repeatedly at multiple points in time? Do you recall?
I can't recall it's the number by heart. I need to check this. I think it was about, I can have a look in this but we were also surprised because what our feeling was that usually context is assessed during process evaluation. So that is often the case, and in our understanding, it's really helpful to have this information already in the beginning. So what we think about also in view of hybrid designs, that we have like a hybrid type 1A, which is the current design, and like a hybrid type B, where you already start with the contextual analysis, and that you already have some information that allow you to develop implementation strategies, for example. So it's not the main focus on testing those implementation strategies, but already have a kind of idea about what is helpful. So this was really something also for us where we were surprised that there are some studies that assessed it.
Yeah, thank you very much. I was too, and for the others, I'll just call out. I think related to that, your other great work on looking at context, as a dynamic approach or framework or conceptually. So some of your other work there today. We'll see maybe if we have time to have you give a few hints about that or description of that one, but I love that. Again, like you, I was pleasantly surprised to see that approach at the different points in time.
Yeah.
Hi, this is Renee Ferrari. I just had a comment on that assessing at different points in time. And for us, we did kind of a contextual analysis at the beginning, and then kicked off our trial and our implementation trial in March of 2020, and very quickly realized that we would be, that the clinics we were working with and the health systems were encountering just obvious all kinds of impacts of COVID, that while we had regularly scheduled meetings to kind of co-develop and co-implement this intervention, we hadn't really thought to add any kind of, contextual assessment throughout the implementation in a more formal way than just kind of check-ins. And so because of COVID, that had us, actively and more systematically asking about and collecting qualitative data around their changing context. So I saw that as an opportunity, and as something that I think we'll, continue to do with future implementation projects, is to do that sort of at least qualitative contextual assessment throughout the life of a project. And so I appreciate you bringing this up. It's really great presentation and great information. Thank you.
Yeah, and I think COVID is really a nice example. And this is something also when referring to the CC framework, this would be something like another intervention that pops up. So you have your intervention you would like to implement, but there's something else that comes up and really affects your implementation. And I think that the point related also to qualitative methods for assessing context over time, we also discussed several opportunities. That's not always the data collection, but you can also have informal meetings with your stakeholders to get an idea what is currently going on in the context and what is changing. Are there changes in the leadership or in procedures or anything else? So this is also something which, can be very helpful.
There was a question in the chat, if I may pull it in from Patty. Patty, would you like to come on, or would you like me to just read this?
No, I'm happy to come on. I was just wondering what, and I may have missed it, what the purpose for exclude. I think I may have understood it through the question and answer period, but just specifically why you excluded the process mapping or process evaluation papers from your initial review, because that is often where context is initially analyzed and then reanalyzed in terms of its interaction with the intervention later. So just was wondering about that.
Yeah, thank you so much for bringing that up, because I think that's a question that is often asked, and we decided that we want to include studies that really focus on context as a foundational phase on contextual analysis. So we excluded those studies that only assessed context as part of the process evaluation, which does not mean, I mean, we also had some studies that assessed context in the beginning, but throughout and also as part of the process evaluation. But those papers that did it only afterwards were excluded. And I think that's related to our understanding of contextual analysis, how we see it.
And if I could just follow up quickly. So in your mind, when you're defining process evaluation, you're talking about post-intervention of implementation strategy process evaluation, not the process evaluation of something before you make an adaptation or, like existing health services delivery that you're evaluating prior to designing where your intervention would be delivered. Is that correct? I'm just trying to think about this sequence, because often we might evaluate kind of the health system processes that are in place in order to, and the contextual variables around that, in order to design when and how we introduce our intervention to study, our intervention and the implementation strategies, and those contextual interactions with the health services might define the right implementation strategies, and then you would evaluate it post hoc. So I'm just trying to, when you say process evaluation, are you talking pre or post the actual study of the intervention of an implementation strategy?
Yeah, it's exactly as you said, post when you implemented your intervention and tested it, and then you study contextual factors that influenced the intervention effectiveness or implementation outcomes. Yeah.
Super. Thank you so much. Thank you so much, Patty, as well. Great question. So I'm looking at some additional wonderful questions, and please keep them coming. I know that we have a really nice, large group today with many newer members, so we would love to hear from you. Bob mentioned that, I don't know, Bob, would you like to come on about the question regarding the pragmatic question about your scale up effort that you are working on?
Yes. This is a very, I think, interesting discussion presentation. Now, in the sense of implementing, I said this is a practical question, because we are trying to scale up nationally an intervention that is getting a lot of backlash. We hadn't, done stakeholder analysis to do barrier analysis to identify these risks that would affect implementation. So the context wasn't really, we didn't understand the context as deeply as we should have done. So looking at the banana approach, the acronym and how you applied it, I'm trying to think, how can this approach help us design a context? How can we learn from this, to help really design a context analysis that can help us, identify gaps, or people to engage and change mindset, because already they have power. My second question is that they have power to actually block implementation, because it's a norms change intervention. It's like it, challenges norms, religious culture. So I'm just thinking aloud, how can I design a context analysis based on what I'm learning today?
Yeah, thank you, Bob, for your question. And that's something, which is really difficult if you know that your context, or there are stakeholders that I think you wrote in the chat that are against the project, and this makes it really difficult. I think the banana provides components to you can think about what you in your planning. And for when you say it's the scale up, you might already have some information about what went well or what didn't went well, and about some contextual issues. And this is really helpful to think about what might be factors that you need more information on and that are really important for this implementation process, and which implementation strategies might be then helpful to target these barriers. So I think that the information you have and also your stakeholders, that they can be really helpful to think through which aspects of context need further consideration in planning the contextual analysis. Does this help a little bit, or?
Yeah, it does. I think I'm looking at some dots that we didn't consider that we should have considered initially, but also like Ross was saying, I think on an ongoing basis, maybe annually, we may want to continue to do context analysis, because context changes. Maybe we may want to rethink and start doing context analysis maybe after every 2 years or so to see how the context is changing, and see if there are any redesigns that are needed.
That's great. Thank you so much. Those are very good discussions we have here. Danielle, I would like to invite you, because you had another one that I wanted to bring to our attention, which is, I think, the million-dollar question, perhaps.
Yeah, thank you, Borshika, and great presentation. I was curious if you were working with an investigator who had limited funds, but they wanted to assess context. Could you recommend just a single measure or one group of measures that would be the most important to evaluate?
I think this would be great if I would know that. Yeah, I think it depends really on the methods you use and how huge your contextual analysis is, because this is all cost intensive if you have a lot of data you collect. And I think here you can, there are some approaches getting together with your stakeholders, for example, use these resources, or we are currently in a project with community pharmacies, and there we implement an intervention that was already implemented in other European countries, and we already have a lot of information about the context, so we can really use also published literature about other projects that give us some kind of information which might be important. So that's where you can narrow down your contextual analysis and make it as lean as possible. Yeah.
Thank you so much. Yeah. It would be wonderful to have one measure, right?
Yeah.
So this is what context is. Looking at the chat again, and Russ, you had an additional follow-up question, so I wanted to invite you to share that.
I'm not sure which one. That was it, the process map or a different one? I had a little note here to bring up something different, but which point were you thinking about?
I'm looking at the one from 945. It says a great question discussed. I think the issue of temporal phase is really important. One question comment, I may have missed it, but did not see if process mapping was excluded or just post-process analysis. To me, the use of process mapping is very useful way to assess context and many other things.
Yes, I think one study used process mapping, and we included this study, but it was only one study. I mean, you see most of them used surveys or focus groups, but yeah.
Yeah, great. Thank you. Yeah, I was just following up on Patty's point that I thought was an excellent one.
Mhm.
Since you did call me out, Borsica, I had one other question. Again, I don't mean to quiz you or put you on the spot. This was a great review, but I'm just intrigued about some of the other issues. And one of the other things that I was pleasantly surprised about in the review were the number of different partners or perspectives or stakeholders, if you were, that were involved there. And again, I was wondering a little more in depth, like, do you just have a general sense for how many of the studies used, let's say, 3 or more of those different perspectives? I was, again, pleasantly surprised. And a lot of the literature I see, it has like the recipients, if you will, the patient or the consumer, and maybe a decision maker or something, but it doesn't have all of those multiple perspectives that I thought was really good. Do you have a sense of that overall?
So when I counted, it's 9 out of 24 that involved 3 different different stakeholders, and the others, as you said, this is also a problem we recognize that often, for example, clinicians are involved that are responsible for implementing the intervention, but those that are really affected are often not involved. And also the same for decision makers, for example, health insurers, or those that really have an influence also in view of resources, funding, and that, I mean, they can really have a major influence of the success of your project, and these are often not involved. And this is also something I think we saw in the map, that it's mainly focused on those implementers. Yeah. And great. Also, what we did not assess is how they were involved. So it's just the methods, and in the end, it's also important to what did they do with those stakeholders? Had they really an impact, or was it just having those on board? And
that's a superb point about how are they involved and how in depth, and if they're involved in an ongoing perspective. But I think just to follow up on a couple of great points I think you made there about understanding the people that are going to be responsible, if you will, the funders or the sponsors for like sustaining a program, if it ever does do well, it's critical. And then also in my experience, I like seeing, and I'm guessing there are different types of the implementers, if you will, but like I do a lot of work in primary care, and often we'll see involved the clinician themselves, then maybe even the lead clinician, but we won't see, if you will, the frontline person that often has to deliver it, whether that's like a nurse or a social worker or whatever. Often I haven't seen them involved, and I think that's another critical, perspective to be involved. But thank you.
Yeah, thank you.
Wonderful. We are getting to the top of the hour. Wonderful discussion. Thank you so much, everyone, for contributing, and Juliane for taking on all these questions. I have one more that I would like to pull from the chat. I don't know, Sarah, if you would like to come on and share it, or I am happy to read it for you.
Sure, thanks. Thanks, Juliane. That was an excellent presentation. I really enjoyed it, and hoping to be able to do something similar. So I'm learning from you. I just wanted to understand from your review, did you actually find out, or did you look at when the people did a contextual analysis, what did they follow up? How did it influence the interventions, how they delivered it, and the what's next? What did they do after the contextual analysis? Because I think it's in the early phase, but if you do it multiple times, how did it actually change the way, and what was the impact of the contextual analysis based?
That's a really important question. And unfortunately, this was not something we could assess in the evidence map. I mean, we tried to figure out what they did with the contextual information, if they used it for further study phases. But as we had a lot of study protocols, it was sometimes difficult to really check if they really did it, if they used it in the further study phases and how. So I can't say what it's had, what the effect was on fidelity. But I would assume if you really use the findings also for your intervention and implementation strategies, it's really a benefit and should support your implementation success. But that's nothing that's, we assessed in the studies.
Thank you.
Yeah.
Wonderful. I am looking at chat. I think we covered everyone's comments. Let me know if not. Any last questions to Juliana? This was fantastic. We really appreciate you taking on this by yourself and on, again, such a short notice. And wow, what a richness it gives when the lead author is here and they can kind of really dig into the details of this study. So we really are grateful. And we were wondering, there is a question about whether we could get your slides. Is that possible to share the slides with the participants? Juliana, is that okay?
Absolutely. I will send them to you afterwards. And I would really like to thank you for having me and inviting us both to this event. It's really a pleasure and great having this discussion and this interesting questions. It's really helpful for us. Thank you.
Yeah. Thank you so much for being here. And Juliana, I mentioned it to Sabina as well, that you are welcome to come back. We will put you on the list and you are welcome to come when you can. We would love to hear your next steps with your work. And thank you for everyone for being here and being so actively involved in the discussion. As Kara mentioned, next month, we have Kelly Upshurner come back with actually Steve Bartle. Dr. Steve Bartle will be here with Kelly, and they will be presenting on their work that includes some usability testing, human-centered design. And so we will be continuing this thinking around context and how do you take that into account. Thanks for everyone for being here again, and all the best to you for this week. I hope you all survive this 1 hour missing sleep. Juliana, good luck to you in 2 weeks when you get to this point. Thanks so much, everyone. Russ, any last last thoughts?
No, just a great way to start off our week, if a little bit early or time behind here. So thank you, Juliana, and this just really superb. So I hope we can continue our interactions with your group going forward.
Yes, thank you very much. This would be great.